remember being very sad. I couldn't tell anyone I was depressed. I did not have any language to explain what was going on. I really couldn't even tell you, like, my diagnosis at that time.
For me, depression started in college, and that was kind of my first experiencing even just like thinking about, am I depressed? It was like maelstrom of miasma. You're trying and working harder to breathe, but that air is so heavy and filled with pollutants. And so for me in college, that is what depression felt like.
A lot of my suicide attempts that were more major were kind of when I was older.
You look for a way to escape, especially when that lens of depression can get dark.
Last week, I really struggled because
It's been hard to share that I have a mental health diagnosis because people think it's not real. It's very, very real.
Untreated depression will metastasize in your life.
It's okay to understand that this is something that is a challenge and an obstacle, and admit to yourself that you are having difficulty facing it. But where it starts with is a relationship between a provider and a patient in treating depression.
I live with my husband, Brian, my son, who is 7, his name is Edwin, and then my daughter, Madeline, she just moved to Phoenix.
Lily.
We have Lily, she's a double doodle, and then we have Frankie, and he's a mutt. There's also Stella, who is our cat, and then there's Darth Vader, the fish. Recently, I started doing like family photos. So scrapbooking is just a hobby I've picked up. I've started a scrapbook for Madeline, but putting my own life into a timeline order has been really difficult. There's just a lot of things that are missing. It makes me sad to see that there's a lot missing.
This is when I was little. These are baby pictures. There's mom and dad. There's not a lot of them together.
My parents were divorced. Definitely a difficult divorce. So my dad had cheated on my mom. I remember like going and searching for my dad, like at different bars. He had alcoholism. And then after the divorce, it was always very unpredictable. My mom, she had a lot of outbursts. I was starting to have trouble in school, running away. I attempted suicide multiple times.
So this is actually when I was diagnosed with depression.
I started seeing Krystal several decades ago at this point. She was starting to have problems with depression, anxiety. Krystal is someone who's battled with pretty severe recurrent depression throughout her life.
Dr. Mattingly was definitely a part of my life. He was always just someone I could go to and talk to. It took several different medications before we settled on anything. I don't know, sometimes I would feel better and sometimes I wouldn't.
We know that some people genetically are more vulnerable than others, but we also know that life experiences, exacerbated by having abandonment, early childhood trauma, adverse events, changes our very DNA. It changes our resilience to stress.
So this is right before I found out I was pregnant, 16 years old. Here's our wedding photo.
My teenage years pretty much ended at that time. I didn't see Dr. Mattingly for a long time, and so I really didn't have an opportunity to be really stabilized. When I was in my 20s, I attempted suicide. I had taken a bottle of pills and washed it down with a bottle of alcohol. That was probably the closest I've ever come to actually dying from a suicide attempt. My mom, she actually put me on a plane and sent me to rehab in Florida because I would have continued until I had destroyed myself.
Major depressive disorder is a group of a certain set of symptoms that affect your brain and your body. It's not just feeling sad, but not being able to feel joy. It's a term we call anhedonia. If I don't feel joy, I give up. If I don't feel joy, I quit. And those symptoms tend to stay stuck for weeks to months on end with patients.
When I was in college, a psychiatrist diagnosed me with major depressive disorder. When I was depressed, something that I noticed was I'm someone who almost gets out of bed like an hour before sunrise. And that was more difficult for me than it should have been. For me, I kept on going back and forth about whether or not I really even had depression in the first place. I found myself sleeping in sometimes until 8 a.m., but I also didn't want to get out of bed even at 8 a.m. I wanted to stay in bed, and it didn't make any sense to me why I wanted to stay in bed, but I just knew that I wanted to. As a writer, depression impacts your creativity and your work very tangibly through things like writer's block or just writing lower quality content. Okay, maybe I should get some help. After an agonizing 3 weeks, I set an appointment with a psychiatrist. And that's when I was diagnosed with major depressive disorder. One of the things that I think I appreciated about my psychiatrist was that he told me this journey of trying to treat mental health illnesses and mental health disorders is not a one-size-fits-all, and it's not a one-size-fits-all forever. Your size changes constantly. The first thing he recommended was an antidepressant with psychotherapy. The antidepressant that he first recommended to me did not work, and it made my depression awful, much, much worse. But I think that helped inform my treatment after that. So a partial response, sometimes you might have to be more patient, other times you might have to look for an alternative option, which was a double medication regimen in addition to psychotherapy.
When we talk about treatment, the brain is just like any other part of the body. If I leave you with a pocket of pneumonia and I let that pneumonia build, what happens? The pneumonia gets worse. It gets harder to treat. It causes more disability. If I relieve you with a pocket of cancer and I don't get rid of all the tumor, the cancer tends to metastasize and cause more damage within your body. The same thing is true with depression.
Hi! So good to see you! I know.
My best friend is a pharmacist. He was in pharmacy school while I was in college, and his specialty is in psychiatric pharmaceuticals.
Like a Yoshi.
Whenever I was prescribed a medication, every single time that I thought about quitting it, he asked me, he's like, if you quit and it gets worse, do you think you can handle the consequences? I knew that if I was in a dark place like I was, I don't think I would be able to handle it. Am I really willing to give up when I know that a problem will always have some level of solution? I've been very lucky to live in an era where we are destigmatizing mental health, particularly depression and anxiety. While I would not have normally been so open about talking about my depression even 5 years ago, I feel compelled but also feel safe to discuss and share such sensitive topics.
You know, most patients have a medication journey, and it's part of their life journey. And one of the things that, I'd certainly like to highlight is, medicine's a tool, but it's not the answer. Medicine helps you get to where you can start work on the answer. I can start working on my own internal image that maybe's gotten damaged because I've been struggling with depression.
Good morning. Good morning. I love you this morning. Yeah. You ready for wake up? Are you ready? Okay. Okay.
I went back to Dr. Mattingly when I was 27 after I got sober. I had taken a break from seeing him for several years. I was afraid to go back at first. And I actually had to call and be like, can I come back?
I've been one of her safe places. She knows it's always okay to call. It's always okay to reach out for help and be vulnerable. It's okay. We're all vulnerable at times. Acknowledging that, coping with that, dealing with that, being honest about that is part of the journey of recovery.
Of course, he said yes and let me come back. My medication became more stable. I was definitely better. And so connection is really important because I trust Dr. Mattingly immensely. Instead of wading through mud, it was like I could, just live life a little bit better. I take care of Edwin. I love watching Edwin grow. What is 15 minus 7?
8.
Yes. Watching him learn a new skill. There's so much bumbling that goes into that. What is 16 minus? As adults, I don't think we're much different. That just has really helped me kind of like not be so afraid to like not get it right away. On a scale of 0 to 100, 0 being not great, I would say I'm probably at like a 60 or 70% now, which is incredible. I was just really struggling for a little while. Dr. Mattingly adjusted my medications.
Krystal's gone through periods where the depression comes back, and an antidepressant by itself just doesn't get the job done. We call them partial responders, where especially during stress, an antidepressant by itself isn't doing the job. She had to go on a medicine that she's taken in the past to help boost the antidepressant response.
It does really make a huge difference in how I feel. When I'm really depressed, that's a huge piece of what I struggle with, is like every little thing takes so much effort. Even now, like when I'm not feeling well, like I have what I call cheat sheets. And it's like, this is what I do to get ready in the morning, and really rely on my routines to keep me going. It's not all medication, but what the medication does is it seems to like help me get to the place where I can do some of those other things that will make me feel better. Recently I started CrossFit, which, because I know exercise is a big thing. A huge part of my life is spirituality. I go to church. I have a church family. We volunteer several different events throughout the year. And then I also do a group called Regeneration, just a group for people who have struggles. Dr. Mattingly, like I just trust him immensely. Like I know he has my back. It's not my destiny to live my life in bed. He believes in me.
I moved to New York after graduating, and that's when I looked for a new caregiver. What I've learned is that if you don't look for help when you are good, then it is so much harder to look for help when you are not so good. I really understood that my major depressive disorder needed a medication regimen coupled with some sort of supportive therapy. My caregivers, through my journey with treating my depression, have allowed me or given me a awakened lens to become more observant. I do enjoy photography quite a bit. One of the ways you treat depression is by finding hobbies and finding beauty in your surroundings. I love taking pictures on the High Line. There's like lots of great buildings and architecture that was really creative. There's like lots of flowers that people plant. I really enjoy floral photography. I love taking still life. You can feel so many different things. You can see so many different things. When you're on medications and you feel good, doing things that work my creative mind is a way to not just like starve off depression, but like to grow. If you just observe your surroundings for even a minute, I think sparks creativity and ignites some sort of like thinking process. I might be crossing the street and all of a sudden I might have like these few lines and I have to write it down. Poetry has always been my most organic form of communication. I think before I spoke, I wrote. Poetry was a way for me to get out thoughts, feelings, sentences, and emotions.
You are at the American Bowery Slam. This is a legendary slam. So it's going to be 2 rounds.
The first poem that I'll be performing tonight, it's called Living with Depression. It takes you through a journey and a metaphor, what it means to live with something like depression as a roommate.
If everyone can please give it up for our poet, Mizkat.
My body is an apartment that I can barely afford because of the location. An entire world of possibilities, accessible in some multiple of my footsteps, and for some reason, I can't make it out my front door. I'm staring at the splintered wood in the frame where the door was slammed on the way out and ignoring the leaks on the roof.
I'll know that I'm at a place where I have gotten better and gotten good enough to the point of satisfaction with my mental health journey once I've created material that, as a writer, I am proud to have published or proud to have written.
I have a roommate now, or maybe I always have. Someone who started out as the silhouette stranger on the other end of the bedroom of my brain. I am living with depression. There's no other way to put it.
The courage it takes among those patients, the strength, the resilience it takes among those patients to live when they're dealing with depression. I want to make sure I reflect that courage back to them. Over time, Krystal's had a lot of wins in life. Having a stable marriage, being a good mom, going back to school, when she thought that was kind of beyond her grasp at first. I can remember Krystal at first, I can't do this, this is too hard. Like, yeah, you can. Hang in there.
I earned a degree in psychology, and then I got my master's in counseling. And now I'm a professional counselor. I work with clients who have experienced traumatic events. What is so terrible about trauma is that it just causes you to believe like these terrible lies about yourself or the world. They're just not true, but they feel really true. And you just need somebody to walk with you and kind of like help change your perspective.
Hey, Krystal. Hey. Come on back.
What's been really incredible is that Dr. Mattingly and I are in the same building.
So, Krystal, how have you been?
I feel like I've been doing better.
So, having a sense of purpose?
Yes, matters. Yeah, it helps.
Think about how much that helps you on your journey.
Yeah.
So, one of the taglines I've used for years is prescribe with hope. And you're going to stick together to walk them through the journey. It's the relationship you build with them. And you know, Krystal's learned that, the importance of that, not for just for herself, but also for the patients that she cares for now as a therapist. You know, it's a fair amount of pride to see Krystal as a fellow colleague.
Dr. Mattingly is a stable constant, and he is a solid encourager. He's like, I'm proud of you. I'm like, okay, I can keep going. He sees me when I'm at my worst. He definitely still is there, and he still believes in me, and he still sees that I can do things and can like contribute to the world. And that's really encouraging.
If you are taking an antidepressant but still experiencing depression symptoms, consider talking to your doctor.